And we now come to the backbench debate on children's health. And I call Dr. Simon Offer.
Thank you, Madam Deputy Speaker. And can I also thank the Backbench Business Committee for approving this really incredibly important debate. I mean, the ambition of this government is to raise the healthiest generation of children ever. And so in the 10-year plan, the Fit for the Future, there's so many things about really improving child health. And I'm actually genuinely quite excited about the 10-year plan. Maybe I'm sad, but that's the sort of thing that does excite me. I've been a GP for 30 years. I have a special interest in child health and also in child mental health. I'll talk very briefly about prevention, mental health, and then a little bit about paediatric services. So, first of all, obesity is a massive problem in young people. At the age of 5, 10% of children are obese. By the age of 11, 22% are actually obese, and that doesn't count the children who are overweight. So, a couple of quick things. If you go through a child's life, it starts in a pregnancy. You must ensure that pregnant women have really healthy diets. That reduces obesity. When they're born, if they're given particularly follow-on milks and hungry baby milks are basically just milk packed full of sugar. That is not going to do the child any good. If they're hungry, they need to change their diet, possibly go on to solids. If you also look at baby snacks that look healthy, they've got a nice healthy carrot on them. If you look what's in them, often they're packed full of sugar as well. So we need to really get a very clear idea of what's healthy so parents can choose the healthiest foods for their children. In terms of advertising, the government is going to bring in a junk food watershed around advertising. It was going to be in October. It's now promised for January. And this is incredibly important because advertising young people are very sensitive to advertising. And can I also mention there's a recent BMJ report about sports sponsorship. So there's over 90 different foods which are sponsored through football and 6 other sports. And all those foods are high in fats and salts and sugars. And we really need to look at that because young people look at their sports stars and they're very, very influenceable at that time. So they have to advertise healthy foods, otherwise we'll continue to have an obesity epidemic. I was also delighted to see in the 10-year plan things around the NPPF about fast food outlets near schools. We must stop these. These are cynically placed close to schools and are particularly prevalent in more deprived areas. A couple of other things that I'm delighted about. Free school meals to everyone who receives universal credit. That's free school meals have got a very obvious relationship to obesity, tend to bring down obesity. And I'm also really delighted that in the autumn we're going to look at the school food standards and hopefully we'll reduce the amount of processed meat, particularly, which seems to be in a lot of school foods. And then the other part of the 10-year plan that really excites me is this mandatory health food sales with supermarkets. That's been evidenced to reduce obesity, so I'm delighted about that. So, going on very quickly, because I'm very keen that everyone else gets an opportunity to talk, physical exercise. 50% of children are not sufficiently active. 2/3 of children cannot swim 25 metres. Certainly, yeah.
I thank my honourable friend for giving way. Does he agree with me that the lack of investment by the last government in vital leisure facilities, like the swimming pool in my constituency in Atherstone, which is really overdue for a renovation, is causing many of these problems, and the lack of PE in schools and the lack of safe places for children to play, be active and get involved in sport is causing some of these obesity problems?
Yeah, no, I totally agree, and in fact you preempted some of the things. So another thing in the 10-year plan is about actual investment through Sports England of £250 million into this type of opportunities for children. I'd also say there's an organisation called the Starlight Children Foundation that promotes play and exercise. And I'm a particular fan of adventure playgrounds in urban areas, which allow children to really cut loose, particularly after school, and really expend some energy and have fun in a safe setting. One other thing to say, something that I'm also working on with colleagues, is about access to nature. It's incredibly important that every child has access to nature so that they can explore nature and also have that type of exercise. And one other thing I'd like to stress is 50% of children have active travel to get themselves to school, so that's bike or walking. Let's increase that. Let's try and get more children cycling and walking to school, because that will just increase their fitness. A couple of very quick things. Dental care is also in the 10-year plan. I'm delighted to see supervised brushing is already there, and I'm also delighted to see fluoride varnish is going to be applied by people to children to prevent dental caries occurring. And also a quick shout out about asthma. Asthma prevention is key, and that's all about air quality. I know some young people who, since the ULEZ scheme, have actually stopped using their inhalers because pollution has gone down. So that's something we must stress. Can I also... Certainly, yeah.
On the point of air quality, I wonder if he'll join me in paying tribute to all the Stop the Stink campaigners in Newcastle and Lyme who fought so hard to clean the air around schools like St Mary's Primary School on Silverdale Road, for example. Their work helped make the lungs of our young people that bit healthier.
Absolutely, and thank you for that intervention. You're absolutely right, and I think that clean air is one of the 5 most preventable health risks that we have, and we must do more around clean air. Now, I want to very quickly come on to early... Yeah, certainly, yeah.
I wonder whether he'd join me in calling on the government to adopt the World Health Organization levels for PM 2.5, excuse me.
Yeah. I'm afraid that this is not my special area, but it sounds like a very good idea, the way he's looking at it. So thank you for that. Really, clean air, it's rather sort of, because we can't see it, we don't realise what it's doing, but genuinely people need their inhalers less, and that's something, particularly for young people with asthma, is really incredibly important. So I just wanted to very quickly talk about early years support. Now, in Gloucestershire, we have an organisation called Home Start, and this involves volunteers going into homes of women who have just given birth and supporting them. And what's interesting is that those women who have had that support often go on to be volunteers. Fantastic organisation. What I was absolutely delighted with this week is the successor to Sure Start, Best Start, which are family hubs, are coming back. And probably in the last Blair government, I would say Sure Start was one of the most glorious things that we did, and also it affected the health of young people enormously. I'm also very pleased that childcare is getting much more funding, and also in the 10-year plan, Healthy Start is going to be restarted in 26-27, providing money for deprived or people who have difficult means, who are both pregnant and the 1 to 4-year-olds. That will really help less well-off people. So very quickly, going on to mental health. Mental health, we are in a bit of crisis. 25% of young people have mental health issues. We only spend 10% of the NHS money on mental health, and actually it contributes to over 20% of the morbidity. There's about 1 million people on the CAMHS waiting list at the moment, and I know that my honourable friends are doing all they can to bring that down. So, to prevent mental health, we need to have exercise, like I've said. We need to look at music in schools. It's been proven to reduce rates of mental health. Also, I'm backing the NEU plan around getting rid of SATs. SATs causes an enormous amount of tension and stress in young people. And then in terms of treatment, I was really delighted that we're going to have mental health support teams in every school. 60%, I understand, by next April, 100% by the end of the Parliament. We're going to have 8,500 more mental health workers. We're going to have a whole school approach, and I particularly endorse the mental health first aid training that's happened in some Stroud schools, and I'm also looking at the Young Futures Hub. Can I also say that with this massive waiting list and this sudden increase in neurodiversity, we need to look at schemes that could go into the waiting list, sometimes 2 years in my area, and use creative and social prescriptions to deal with those children. I reckon a lot of those, given the right support, will not need specialist psychiatric assessment. And can I also say that I'm a chair of the All-Party Parliamentary Group for Beyond Pills. Did you know that 1 in 8 12 to 17-year-olds have been put on an antidepressant, an SSRI? That is scandalous, in my opinion. So, just coming to a brief conclusion, this year I hosted a round table of the Royal College of Paediatric and Child Health children are generally waiting longer than adults for care, and this is something we must turn around. Mental health, as I said, has often got very long waiting lists. And can I just say one thing about a constituent of mine? The mother, Louise Turner, her son, Harry, sadly had a sarcoma and died at the end of last year. But she reports fantastic nursing staff, fantastic doctors, but a lack of facilities. So sometimes they would turn up for their chemotherapy and there wouldn't be a bed for them and they had to go away to the next day. So we must make sure that that doesn't happen going forward. So what is the solution to this? What we need to do is we need to get paediatric care out of the hospital and into the community. That means we need to get hot paediatrics, that's feverish kids, seen in the community, potentially by paediatricians or well-trained GPs. And I also think in GP training, something that I've done for about 25 years, every single doctor who becomes a GP should have time in a paediatric assessment unit. I think that's essential. Also, the main feedback from the round table from the Royal College of Paediatrics and Child Health is if we design services for children, we must involve the children in designing those services, otherwise they won't work.